ZEMBRACE Symtouch, sumatriptan injection 3 mg. Keep watching to learn the instructions for use. What is ZEMBRACE Symtouch used for? ZEMBRACE Symtouch is a prescription medicine used to treat acute migraine headaches with or without aura in adults who have been diagnosed with migraine. ZEMBRACE Symtouch is not used to prevent or decrease the number of migraines you have. It is not known if ZEMBRACE Symtouch is safe and effective in children under 18 years of age. What important information should I know about ZEMBRACE Symtouch? ZEMBRACE Symtouch can cause serious side effects, including heart attack and other heart problems, which may lead to death. Stop using ZEMBRACE Symtouch and get emergency medical help right away if you have any of the following symptoms of a heart attack: chest pain or chest discomfort that feels like an uncomfortable heavy pressure, tightness, or heaviness, or pain that lasts for more than a few minutes or that goes away and comes back, pain or discomfort in your arms, back, neck, jaw, or stomach, shortness of breath, breaking out in a cold sweat, nausea or vomiting, feeling lightheaded. ZEMBRACE Symtouch is not for people with risk factors for heart disease, high blood pressure, high cholesterol levels, smoking, overweight, diabetes, family history of heart disease, unless a heart exam is done and shows no problem. Please see complete important safety information at the end of this video. Before getting started, it's important to note that the following information doesn't take the place of talking with your healthcare provider about your medical condition or treatment. You and your healthcare provider should talk about ZEMBRACE Symtouch when you start using it and at regular checkups. The ZEMBRACE Symtouch pen is a single-use, pre-filled injection device. The device should be used only one time and then discarded. And some additional precautions to know. Keep out of reach of children. Do not use after the expiration date has passed. Do not store or expose to high temperatures. Do not freeze. Do not remove the red cap until you are ready to inject. Do not use if dropped after removing the red cap. Do not put or press thumb, fingers, or hand over the yellow needle guard. Doing so may result in a needle stick injury. Step 1. Once you've removed a pen from the carton, be sure to check the expiration date on the auto-injector and inspect the medicine through the medicine viewing window. The contents of the window must appear anywhere from clear, colorless, to a pale yellow solution. In addition to ZEMBRACE Symtouch, there are a few other supplies to gather before treatment. These include an alcohol swab, a sterile cotton ball or some gauze, and a puncture-resistant sharps container. Keep watching for more information about proper disposal of the pen later in this video. Step 2. Now it's time to choose your injection site. It's recommended to administer ZEMBRACE Symtouch on the sides of your thighs or arms. Be sure not to inject wherever your skin may be scarred, bruised, tender, red, or near any open wound. It's important that you clean your injection site with the alcohol swab and refrain from touching the injection site after cleaning. At this time, you're ready to remove the red cap by holding the body of the pen in one hand and pulling the red cap off straight. And stay away from that yellow needle guard. Step 3. Now you're ready to inject. Place the pen straight onto your injection site with the yellow needle guard end pressed gently against the skin. Once set, press and hold the device firmly against your skin. You'll then hear the first click as the injection starts. Continue to hold down the pen until you hear the second click. Now, before removing the pen, slowly count to 5 to make sure you receive your full dose of ZEMBRACE Symtouch. At this time, you may safely remove the pen by lifting it straight away from your skin. The yellow needle guard will drop down and lock over the needle. Step 4. There's one last thing you'll have to do before throwing away the medication. Look to confirm that the red plunger rod has filled the medicine viewing window. This means you have received the full dose of ZEMBRACE Symtouch. Call your healthcare provider if the plunger rod has not filled the viewing window. This may mean that only a partial dose was delivered. Do not try to reuse the pen. And now that you have finished administering your migraine treatment, we need to complete proper disposal. Put your used pen, caps, needles, and sharps in an FDA-cleared sharps disposable container right away after use. Do not throw away any loose needles and syringes in your household trash. Do not recycle your used sharps disposable container. If you do not have an FDA-cleared sharps disposable container, you may use a household container that is made of a heavy-duty plastic, can be closed with a tight-fitting puncture-resistant lid without sharps being able to come out, upright and stable during use, leak-resistant, and properly labeled to warn of hazardous waste inside the container. When your sharps disposable container is almost full, you will need to follow your community guidelines for the right way to dispose of your sharps disposable container. There may be state or local laws about how you should throw away used needles and syringes. For more information about safe sharps disposal and for specific information about sharps disposal in the state that you live in, go to the FDA's website at www.fda.gov/safe sharps disposal. Remember, never recycle your sharps container. If you notice a spot of blood at the injection site, you can treat it by dabbing a cotton ball or gauze pad and covering with a bandage as needed. Be sure not to rub the injection site. What important information should I know about ZEMBRACE Symtouch? ZEMBRACE Symtouch can cause serious side effects, including heart attack and other heart problems, which may lead to death. Stop using ZEMBRACE Symtouch and get emergency medical help right away if you have any of the following symptoms of a heart attack: chest pain or chest discomfort that feels like an uncomfortable heavy pressure, tightness, or heaviness, or pain that lasts for more than a few minutes or that goes away and comes back; pain or discomfort in your arms, back, neck, jaw, or stomach; shortness of breath; breaking out in a cold sweat; nausea or vomiting; feeling lightheaded. ZEMBRACE Symtouch is not for people with risk factors for heart disease, high blood pressure, high cholesterol levels, smoking, overweight, diabetes, family history of heart disease, unless a heart exam is done and shows no problem. Who should not use ZEMBRACE Symtouch? Do not use ZEMBRACE Symtouch if you have heart problems or a history of heart problems, had a stroke, transient ischemic attacks, TIAs, or problems with your blood circulation, narrowing of blood vessels to your legs or arms, peripheral vascular disease, stomach or kidney, uncontrolled high blood pressure, hemiplegic migraines that make you unable to move on one side of your body, or bacillar, rare forms of migraines with aura migraines. If you are not sure if you have these, ask your healthcare provider. Taken any of the following medicines in the last 24 hours: sumatriptan, amitriptan, elatriptan, frovatriptan, naratriptan, rizatriptan, sumatriptan and naproxen, ergotamines, or dihydrocotamines. Ask your healthcare provider if you are not sure if your medicine is listed above. Severe liver problems, an allergy to sumatriptan or any of the components in ZEMBRACE Symtouch. What should I tell my healthcare provider before taking ZEMBRACE Symtouch? Tell your healthcare provider about all of your medical conditions and about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What should I avoid while using ZEMBRACE Symtouch? ZEMBRACE Symtouch can cause dizziness, weakness, or drowsiness. If you have these symptoms, do not drive a car, use machinery, or do anything where you need to be alert. What are possible side effects of ZEMBRACE Symtouch? ZEMBRACE Symtouch may cause serious side effects, including changes in color or sensation in your fingers and toes, Raynaud's syndrome, stomach and intestinal problems, gastrointestinal and colonic ischemic events, problems with blood circulation to your legs and feet, peripheral vascular ischemia, hives, itchy bumps, swelling of your tongue, mouth, or throat, medication overuse headaches. Some people who use too many ZEMBRACE Symtouch injections may have worse headaches, medication overuse headache, serotonin syndrome. Serotonin syndrome is a rare but serious problem that can happen in people using ZEMBRACE Symtouch, especially if used with antidepressant medicines. Call your healthcare provider right away if you have any of the following symptoms of serotonin syndrome: mental changes such as seeing things that are not there, hallucinations, agitation or coma, fast heartbeat, changes in blood pressure, high body temperature, tight muscles, trouble walking, or nausea, vomiting, or diarrhea, serious allergic reactions. Get medical help right away if you have any of these symptoms of a serious allergic reaction: swelling of your face, lips, mouth, or tongue, trouble breathing, wheezing, severe itching, skin rash, redness, or swelling, dizziness or fainting, fast heartbeat or pounding in your chest, or sweating. Seizures have happened in people taking sumatriptan who have never had seizures before. The most common side effects of ZEMBRACE Symtouch include pain or redness at your injection site, tingling or numbness in your fingers or toes, dizziness, warm, hot, burning feeling to your face, flushing, discomfort or stiffness in your neck, feeling weak, drowsy, or tired. ZEMBRACE Symtouch, the pen that goes with you. Migraine relief designed with you in mind. Learn more at zembrace.com.